Assalamu alaikum. Our lecture today is the spinal cord. Our objectives are describe the external features of the spinal cord, describe the meninges covering the spinal cord and their specialization, list the meningeal spaces and enumerate their content, specify the anatomical basis of lumbar puncture and epidural anesthesia, define the dermatomes and myotomes, and lastly, specify the blood supply of various parts of the spinal cord. Let's we start by the first objective, which is the external features of the spinal cord. Firstly, the length of the spinal cord and the extent of the spinal cord. The length of the spinal cord, as we see here, this is the spinal cord. Its length in the adult ranging from 42 to 45 centimeters. It extends as a downward continuation of the medulla oblongata. Downward continuation of the medulla oblongata. Okay, the medulla oblongata is the last part or the lower part of the brain stem. Its downward extension called the spinal cord or spinal medulla. تمام. Spinal cord extends from the first cervical vertebrae to the lower border of the first lumbar vertebrae, extending here from the first cervical vertebrae, from the upper border of the first cervical vertebrae to the lower border of the first lumbar vertebrae, lower border of the first lumbar vertebrae. So the extent of the spinal cord, it extends from the first cervical vertebrae upper border to the first lumbar vertebrae like this lower border. Again, in adult, the spinal cord occupies the upper two-thirds of the vertebral canal, as we say, as we showed before. It begins as a downward extension of the medulla oblongata at the level of the upper border of the first cervical vertebra, then extend down to the level of the lower border of the first lumbar vertebra. This level varies from the flexion or external or extension position of the person. When the person is lying extended, the spinal cord is elevated rather than the person is lying or in the extended position. So the length of the spinal cord is about 42 to 45 centimeters long. There are changes in the extent of the spinal cord in the position of the spinal cord inside the vertebral canal. Here, as we said, in adult, the spinal cord extends from the upper border of the first cervical vertebrae to the lower border of the first lumbar vertebra. Okay, this is occurs in adult. But what about the intrauterine life? What about the fetus in the uterus? In the third month, in the third month of the intrauterine life, the spinal cord fully occupies the vertebral canal. Fully occupies the vertebral canal. Okay. As a result of further growth, the bone grows faster than the nervous tissue. The bone or the vertebrae grow grow faster than the spinal cord, which is the nervous tissue. And as a result of this, when the baby is born, so at birth, the lower end of the spinal cord end at the level of the third lumbar vertebrae. End at the level of the third lumbar vertebrae. So the extension of the spinal cord in at birth, extend from the upper border of the first cervical vertebrae to the third lumbar vertebrae. As a result, as a result of continuous growth, the bone grows faster than the nervous tissue. So when we reach the adult life or from the 70th year, we find the spinal cord end at the level of the upper upper border of the second lumbar or lower border of the first lumbar or the disc between the first and second lumbar. Okay, again, in the intrauterine life third month, the spinal cord fully occupies the vertebral canal as a result of rapid growth of the bone rather than the nervous tissue. The spinal cord at birth end at the third lumbar vertebrae. with further development in adults or by beyond the age of 70 years, spinal cord ends at the lower border of the first lumbar vertebrae. Age-wise changes in the spinal cord, and this is very important. In the third month of the intrauterine life, completely fills the vertebral canal. In the new form, it ends at the third lumbar vertebrae. This is because the spinal cord doesn't grow as much as the vertebral column. The vertebral column has faster rate of growth. In adult life, the spinal cord ends at the lower border of the first lumbar vertebra. The second objective, or the second part of the first objective, which is the external features of the spinal cord, we discussed the length and extent of the spinal cord. Now we will discuss the segments of the spinal cord. If we look at the spinal cord, we find it as a cord, but this cord is divided into parts. Okay, this segments has a total number of 31 segments. So the spinal cord is divided into 31 segments. 31 segments. Each segment of the spinal cord gives origin to a pair of spinal nerve, right and left one. So the number of the spinal nerves are 31 pair of spinal nerves. Okay, the segments are called according to the region where they lie. So in the cervical region or in the neck, the spinal cord contains eight segments. Eight segments. Okay, here is the spinal cord segment from C1 to C8 lies in the neck region. And note that the number of the cervical vertebrae is seven. Seven cervical vertebrae. But the spinal cord segments in the neck region are eight. Eight spinal cord segments and eight pairs of spinal nerves. In the thoracic region, the spinal cord contains 12 segments. 12 segments. Okay, this number is corresponding to the 12 thoracic vertebrae. In the lumbar region, the spinal cord contains five segments. Five spinal cord segments give rise to five pairs of spinal nerves. In the sacral region, we have also five sacral segments. Five sacral segments. And lastly, the end of the spinal cord is the coccygeal segment. This is one segment called coccygeal segment. Okay, so the number of the spinal cord segments are 31 segments. The number of the pairs of the spinal nerves are 31 pairs of spinal nerves. So what is the spinal cord segment? What is the spinal cord segment? It is a part of the spinal cord which give origin to a roots of a pair of a spinal nerve. So each segment of the spinal cord give origin to one pair of the spinal nerves. What are the cord segments? The cord segments are 31 segments. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal segment. And this number corresponds to the number of the pairs of the spinal nerves. Note, here there is 8 cervical cord segments and 8 pairs of the cervical nerves, but there is only 7 cervical vertebrae. These segments of the spinal cord showing enlargement in specific areas. The segments of the spinal cord in specific areas showing enlargement. These areas give origin to important nerves that supply the upper and lower limbs. So we have two enlargements. We have two enlargements of the spinal cord. The site of enlargement is corresponding to the spinal cord segment that supplies the upper limb, which form the cervical plexus. Cervical plexus. And this enlargement called cervical enlargement. So the first spinal cord enlargement occurs here at the region of formation of nerves of the cervical plexus to supply the upper limb, and this enlargement is called cervical enlargement. The second enlargement here is called lumbosacral enlargement or lumbar enlargement. Lumbar enlargement. This enlargement gives origin to a plexus called lumbosacral plexus. Lumbosacral plexus supplying the lower limb. So the spinal cord has two enlargement, cervical enlargement and lumbar or lumbosacral enlargement. So the enlargement of the spinal cord are caused by amount of gray matter in the segment. This is increase in the gray matter in the segment, so it gives enlargement. And this present at the site involved in formation of plexus. Okay, there are two enlargements of the spinal cord. The first one is the cervical enlargement. Cervical enlargement, which extends from the cervical segment C to the second thoracic nerve segment. From the cervical segment C to the second thoracic segment. And this is gives origin to a plexus, which is the cervical plexus supplying the shoulder and upper limb. The second enlargement is the lumbar enlargement, which extends from the first lumbar segment to the third sacral segment. And this gives origin to a plexus of nerves which called lumbosacral plexus, supplying the nerves of the lower limb and the pelvis. Again, we are talking about the external feature of the spinal cord. Firstly, we discuss the length of the spinal cord is about 42 to 45 centimeters. The extension of the spinal cord in adults, it extends from the upper border of the first cervical vertebrae to the lower border of the first lumbar vertebrae. Second, we discuss the segments of the spinal cord. The spinal cord formed of 31 segments. 31 segments which are divided according to the region. So in the neck region, we will find 8 cervical segments. In the thoracic region, we find 12 thoracic segments. In the lumbar region, we find 5 lumbar segments. In the sacral region, we find 5 sacral segments. And lastly, in the coccygeal region here, we find 1 coccygeal segment. And as we said, these segments are corresponding to the spinal nerves. So the spinal cord segment is the part of the spinal cord which give origin to only one pair of the spinal nerves. Okay. Second, we discussed that there is two enlargements of the spinal cord in which the gray matter of the spinal cord are expanded to form enlargement, and this is occurs in the area of formation of plexus. These two enlargements are cervical enlargement here, and lumbar enlargement. Okay, the cervical enlargement involved with formation of the cervical plexus, and lumbar enlargement involved with formation of the sacral lumbosacral plexus. The cervical The lumbar enlargement extends from the first lumbar to the second or third sacral segment. Now we will discuss grooves of the spinal cord. If we look to the spinal cord, we find its outer surface is not smooth. It shows grooves. The grooves are called sulcus, sulci. Okay, so if we look to the spinal cord as we take transverse section of the spinal cord, we will find here a deep groove or a deep sulcus here, a deep groove or a deep sulcus here. This is called anterior median fissure. Fissure means deep groove or deep sulcus. Okay, this is the anterior median fissure or anterior median sulcus extending along the midline of the spinal cord anteriorly. Opposite to it, posteriorly here, we find the posterior median sulcus. Here, posterior median sulcus. At both sides of the spinal cord anteriorly, at the origin of the exit of the anterior anterior root of the spinal nerve or the motor root of the spinal nerve here, we find another sulcus, one on the right side and the other of the left side, and they are called post and anteromedial sulcus. Anteromedial sulcus. The opposite to them here at the origin of the dorsal root or sensory root, the spinal nerve, and this is called and this sulci called dorsolateral sulcus. So, if this is the transverse section of the spinal cord, if we look here, what is this? This is the anterior median sulcus or anterior median fissure. Anterior median fissure. If we look here posteriorly, we will find what? Posterior median sulcus. If we look here, this is the posterior lateral sulcus, one on the left side and the other is on the right side. And if we look to it anteriorly, we will find the anterior lateral sulcus. So we have sulci dividing the spinal cord at its external surface. Here, this is the anterior median fissure or sulcus extending in the midline anterior. The posterior median sulcus extending or present in the midline posterior. In both sides of the posterior median sulcus, this is two posterior lateral sulcus, and in both sides of the posterior median sulcus, here, this is anterior lateral sulcus. Again, the grooves of the spinal cord or bilateral symmetry of the spinal cord. The spinal cord is bilaterally symmetrical. So the grooves divide the spinal cord into right and left parts or the posterior median sulcus on the midline posteriorly, the anterior median sulcus or fissure. This is a deep groove on the anterior side or in the midline. In both sides of the posterior median sulcus, we find the posterolateral sulci. This is at the entry of the dorsal or sensory roots. The anterolateral sulci emerged at the ventral or in motor roots of the spinal nerves. Now test yourself. Number one. Number one here is the posterior median septum. Septum. Here the posterior median sulcus and extending from its septum called posterior median septum. Number two, yes, anterior median fissure. Number three here is called intermediate. Here at the exit of the spinal nerve sensory root, this is the posterolateral sulcus. But this septum is called postero-intermediate septum. Okay. Four here is the anterolateral sulcus. Anterolateral sulcus. The spinal nerve, as we said, each pair of spinal nerve appears from the spinal cord segment, and the both have the same number. So the spinal cord, as we see, the spinal nerve, as we see, each pair, right and left, appears from a spinal cord segment. It appears by two roots. Anterior root, which exits or enters the spinal cord as the as the anterolateral sulcus here. This is the motor root or ventral root or anterior root. And here posteriorly, this is the dorsal root or sensory root. It enters the spinal cord as the dorsolateral sulcus. The two roots of the spinal nerve unite together to form what is called what's called the spinal nerve. The spinal nerve. The sensory root here is purely sensory. The motor root here is purely motor. But after their union to form one spinal nerve. This is a mixed nerve. The spinal nerve is a mixed nerve. The spinal nerve is divided into dorsal branch supplying the skin and the muscles of the back according to the region, and ventral branch, which is a mixed nerve supplying the skin and the muscles of the front of the body or anterior body wall. So branches of the dorsal and ventral branch and ventral divisions are mixed branches. Again, the spinal nerve appears from the spinal cord by two roots, ventral motor root and dorsal sensory root. They unite together to form the spinal nerve or the trunk of the spinal nerve, which carry mixed fibers. This trunk is divided into dorsal ramus, which is supplying the muscles and the skin of the back to is mixed, and ventral ramus, if you remember, we studied last year formation of the cervical plexus by this ventral ramus. The ventral ramus. So it's supplying the muscles and the skin of the anterolateral wall of the body. Again, what is the number of the spinal nerves? Excellent. 31 pairs of the spinal nerves and have the same number as the spinal cord segment. Each spinal nerve divided or arise by two roots, anterior root, purely motor, and posterior root, purely sensory. Just proximal to the junction of the roots, the dorsal root is marked by swelling, called dorsal root ganglion. Any sensory nerve must have relay ganglion. So, the dorsal root ganglia is the relay ganglion of the spinal nerve. Both the roots of the spinal nerve receive a tubular prolongation from the spinal meninges and enter the corresponding intervertebral foramen. In the intervertebral foramen, anterior and posterior nerve roots unite to form mixed nerve trunk or spinal nerve. The spinal nerve made up of mixture of motor and sensory nerves, so it is a mixed nerve. Now this is the clinical application of the segmentation of the spinal cord. What is this? Dermatomes and myotomes. As we discussed before, the spinal cord is divided into segments. These segments, or each specific segment, give origin to a specific pair of the spinal cord. So, if one pair of the spinal cord goes to supply the shoulder, we now specify the area of the skin supplied by a specific spinal nerve, and this is called dermatome. Dermatome. So, what is the dermatome? It is the area of the skin supplied by individual spinal nerve. Again, if we take the journey of one spinal nerve, say the cervical segment number 4 or the cervical segment number 5. If we pass with the spinal nerve after formation of a nerve trunk and division into ventral and dorsal rami, we find the ventral rami of this segment supply specifically this area of the upper limb. Okay, so we can specify this area of the skin and called it is a dermatome of C5 or C5 dermatome. So dermatome means area of the skin supplied by individual or specific spinal nerve or spinal segment. The same if we do this with the muscle. The same if we do this with the muscle. Each muscle receives nerve supply or motor supply from a specific cord segment. So this muscle is called myotomes. Myotomes. The myotomes are segmental innervation of the muscle. As you will study in physiology or histology, you will take the muscle jerk. The muscle jerk is used to examine the spinal cord segments or the spinal nerve, using or depending on the segmentation of the spinal cord and its application in dermatomes if we test the sensation, or myotomes if we test the muscle or the muscle jerk. Okay? like the knee jerk, like the ankle jerk, like the biceps jerk. For example, biceps jerk examine C5 and C6 as these muscles are supplied by specific signals or specific nerves of the spinal cord. If we look at the section anatomy of the spinal cord, this slide will be discussed in detail in the histology. Okay, but I want you to know that the spinal cord is formed of gray matter forming this H-shaped structure, okay, and white matter, this is the outside, the white matter outside and containing the tracts to discuss in the specific picture, and the gray matter containing the cell bodies, okay. Now, what is the protection of the spinal cord? Look here, this is the vertebra. The vertebra, as we discussed in the general lecture, formed of the vertebral body anteriorly and the neuronal arch or spinal arch, the vertebral arch posteriorly. Okay, here this foramen. This foramen is the vertebral foramen. The vertebral foramen. One vertebrae above the other, this foramen will form the vertebral canal. Will form the vertebral canal. And as we said before, the spinal cord present in the upper two-thirds of the vertebral canal. So it gives the spinal cord protection. So the vertebral column gives the first protection to the spinal cord. Here the spinal cord is protected by the bones of the vertebrae or the vertebral column. The second protection for the spinal cord is the meninges. Second protection is the meninges. What is the meninges? The meninges are covering the central nervous system, either the brain or the spinal cord. The meninges are arranged in three layers, from outside towards the bone to inside towards the nervous tissue of the spinal cord, or this outer side cord is the dura mater. Dura mater. Below or under the dura mater, this is the arachnoid mater. Arachnoid mater. And lastly, and other attached to the spinal cord of the nervous tissue is the pia mater. Pia mater. So we have three codes of the meninges from outside dura, then arachnoid, and lastly pia mater, completely covering the spinal cord and provide protection to it. Okay. If we look to these, we will find the dura here, and this is the bone, this is the bone, this is the vertebrae, and here this is a space between the periosteum lining the bone and the dura. So this space is called extradural space, means outside the dura, or second name for this space, epidural. So this space between the endosteum lining the bone and the dura mater, or the epidural space or extradural space. Here, the dura and arachnoid, between them, this is a potential space, small cavity called sub. Sub. Sub means under. Sub means under the dura is called subdural space. The dura and the arachnoid runs together and extend has the same extension together. And the space between them is a potential space and empty space. Potential and empty. Okay? And now we talk about the spaces between the meninges. We have epidural or extradural space between the dura and the endosteum lining of the vertebral canal. Second one is the extradural or epidural space between the dura and the arachnoid. And the last one between the arachnoid and the pia and this very important space called subarachnoid space. Subarachnoid space. This subarachnoid space contains fluid called cerebrospinal fluid, means the fluid that surrounds the spinal cord and the brain, and it's called CSF or the cerebrospinal fluid. and the cerebrospinal fluid is the third protection of the spinal cord. Now we talk about protection of the spinal cord. First protection is the bones of the vertebral canal. Second protection are the meninges, either dura mater, arachnoid mater, or thigh mater. The third protection is the fluid present in the subarachnoid space and is called CSF or cerebrospinal fluid. Okay, here again, this is the spinal cord. This is the spinal cord. This is the inner matter or gray matter, and this is the outer matter or white matter. If we look here, we will find the yes dura matter, this arachnoid matter, and the pia matter is actually adherently attached to the spinal cord. Okay. If we look here, this is the spinal nerve, which spinal nerve appears or attached to the spinal cord segment. Okay, the spaces, this is epidural space outside the dura, this subdural space is the potential space. Here, this is the subarachnoid space containing the CSF. What are the contents of the meningeal spaces? Firstly, the space between the endosteal layer lining the bones of the vertebral canal and the dura mater, called extradural space or epidural space, contains fat called epidural fat or extradural fat. Okay. Also, in this fat, we find a plexus of veins called internal vertebral venous plexus. Internal vertebral venous plexus present here outside the dura in the epidural space. Again, the meningeal spaces are epidural space. It is a well-developed space. It is formed as the spinal dura mater doesn't fuse with the endosteum of the vertebral canal. It contains extradural fat and the internal vertebral venous plexus. It is the site of the epidural anesthesia. Epidural anesthesia is a type of anesthesia occurred by injection or inserting a needle in the epidural space, okay, and the injection of anesthetic drug. This is used to relieve pain as in cases of severe burns or in cases of delivery, vaginal delivery to relieve pain without affecting the action of the muscle. So, epidural anesthesia means injection of anesthetic material in the fat surrounding the dura or outside the dura between the dura and the endosteum. The second space after the epidural is the subdural space, and as we said, it is a potential space. The third space is the subarachnoid space, and as we said, it contains a fluid called cerebrospinal fluid. And the other contents, I will discuss them in the next slide. Look at this. Before I talk about subarachnoid space, I want to know that the lower end of the spinal cord here is conical in shape. The lower end of the spinal cord, which ends here at the level of the lower border of the first lumbar vertebrae here, the lower border of the first lumbar vertebrae here is conical in shape like the cone, and it is called conus medullaris. Conus means cone, and medullaris means spinal medulla, which is the spinal cord. So conus medullaris is the name of the lower end of the spinal cord. Okay. The second you will know is the end of the pia mater. The end of the pia mater, the pia mater is adherent to the spinal cord. So when the spinal cord ends in the first lumbar vertebrae, the pia mater extend downward as a phylum, and called phylum terminal, phylum terminal. So here, this is a phylum called phylum terminal. Phylum means فتلة, شبه الفتلة. So it is called phylum terminal. What about the dura and arachnoid? The dura and arachnoid end here at the level of the second sacral vertebrae. This is the dura and the arachnoid together, extending in the vertebral canal downward to end at the level of the second sacral vertebrae. Here, the level of the second sacral vertebrae. Here, the level of the second sacral vertebrae, the end of the dura and arachnoid. So as a result of this, we will find a space here. This is the subarachnoid space between the pia covering the cord, which end by phylum terminal here, like this is the phylum terminal, and the dura and the arachnoid matter, which are end at the second sacral vertebrae or second sacral piece. This space is called subarachnoid space. This subarachnoid space below the end of the spinal cord, which is dilated and called lumbar cistern. Lumbar cistern. So lumbar cistern is the lower part or the dilated part of the subarachnoid space below the end of the spinal cord. Okay. The pia mater doesn't terminate or end at the level of S2, but it continues downward to end at the level of the second coccygeal piece and attached to it, attached to the coccyx, attached to the dorsum of the second coccygeal piece. So we can divide the phylum terminal into two parts. The part inside the subarachnoid space, inside, so-called phylum terminal interna, and this part outside the lumbar cistern of the subarachnoid space, and it is called phylum terminal externa. Okay, so now we will discuss contents of the subarachnoid space. Firstly, the cerebrospinal fluid. Secondly, the phylum terminal. Phylum terminal. Here, this is the spinal nervous. The spinal nervous. As the spinal cord ends at the lower border of the first lumbar vertebrae, this spinal nerve will descending downward, okay, to exit from the vertebral canal at its corresponding level. So, if this is the coccygeal nerve, it will descend in the vertebral canal till it reaches the last piece of the coccyx and exit from the spinal cord. If this is the fifth sacral segment, will descend in the lumbar cistern and exit from the intervertebral foramen at the last beat of the sacrum to exit from the its corresponding level. This nerve gives the appearance of the tail of the horse, so it is called coda equina. Coda equina means the tail of the horse or the behind of the horse gives the same shape and is called coda equina. So the subarachnoid space contains also the coda equina, which are the spinal nerves which descending downward in subarachnoid space to leave this space at its corresponding intervertebral foramen. So the contents of the subarachnoid space are the roots of the spinal nerves, which are called coda equina, the cerebrospinal fluid, and the phylum terminal. Also, this is space containing the blood supply of the spinal cord, which are called spinal vessels, spinal arteries, anterior and posterior spinal arteries, and veins. Again, what is the subarachnoid space? First, we will discuss the conus medullaris. What is conus medullaris? Is the distal conical end of the spinal cord. So the lower end of the spinal cord is thin, conical spinal cord below the lumbar enlargement. As, as we said, the lumbar enlargement extending from L1 to S2 or 3. Before it, or the part of the spinal cord after this enlargement is thin and conical in shape and called conus medullaris. Okay? What is coda equina? Coda equina, it is one of the contents of the subarachnoid space, and it means the nerve roots extending below the conus medullaris. The nerves that extending below the conus medullaris to leave the subarachnoid space at its corresponding intervertebral foramen, which is the site of exit of the spinal nerves are called coda equina. Phylum terminal, it is thread-like, thin thread, thin thread of diameter at the end of the conus medullaris. As we said, the diameter is adherent to the spinal cord. By the end of the spinal cord, the phylum terminal forming a thread-like or a thin thread to extend in the subarachnoid space. It passes through the sacral hiatus, which is a hiatus in the lower part or at the end of the sacrum, okay, and get attached to the dorsal surface of the first coccygeal vertebrae, and this part is called the phylum terminal externum. Now, what is the fixation of the spinal cord? We discussed the protection of the spinal cord by the spinal meninges, the vertebral column, and the CSF. The spinal cord is fixed in the vertebral canal. As the spinal cord is a nervous tissue and the nervous tissue is soft tissue, it must be fixed to avoid injury, to avoid injury of its structure. So it is fixed by the phylum terminal. As we said, the phylum terminal fixes the spinal cord to the dorsal surface of the coccyx. Another fixation of the spinal cord is the ligamenta denticulata or denticulate ligaments. Denticulate ligaments. Denticulate ligaments fix the spinal cord to the dura nerve. Let's discuss the denticulate ligaments. Here, as we said before, this is the spinal cord. The spinal cord. Adherent attached to the spinal cord is the pia mater. Pia mater adherently attached to the spinal cord. Okay. Here the outer layer is the dura mater. Dura mater. Okay. If we look here, this is a denticulate ligament. Denticulate ligament. What is the denticulate ligament? It is a projection or tooth-like projection extending from the pia mater to the dura. So the denticulate ligament fixes the spinal cord to the dura. The dura is fixed to the vertebral column. So the denticulate ligament extends from the pia mater to the dura. The denticulate ligament interfere with the spinal nerves. They appear or attached or located at the site of the spinal nerves. And we have 31 pairs of denticulate ligament. 31 pairs, sorry, 21 pairs of the denticulate ligament. So they correspond to the spinal nerve segments or passes with the spinal nerves. Okay. Again, what is the denticulate ligament? They are two slight thickening along the lateral aspect of the spinal cord, appears here, not in the midline, but on the lateral aspect of the spinal cord, on both sides of the spinal cord, on the left and right side of the spinal cord, and they appear between the dorsal and the ventral roots. As we said, each one or each denticulate ligament or each process lies opposite a spinal nerve. So the first denticulate ligament corresponds to the first cervical nerve. If we have 21 denticulate ligaments, so we have the last one is passed with the first lumbar nerve. We have 8 and 12, this is 20, and the 21 passed with the first lumbar nerve. So the denticulate ligament fixing the pia mater to the dura are 21 in number. Each one of them passes with the spinal nerve. So the first one corresponding to or passes with the first cervical nerve, and the last one passes with the first lumbar nerve. The pia forms triangular segment which first the arachnoid here like this and attached to the dura. There are 21 pairs or 22, mostly 21 pairs of ligaments, of denticulate ligaments. So the first denticulate, as we said, passes or corresponding to the first cervical nerve. The last denticulate lies opposite to or passes with the first lumbar nerve. Again, we talk about the meninges, and we call the spinal cord surrounded by three layers of meninges. This is the spinal cord. This is the red color is the pia mater. This is the blue color is the arachnoid. And lastly, outside here, this is the dura. Okay. At the end of the spinal cord, its lower end here is conical in shape. This is the lower end and it's called conus medullaris. Conus medullaris. The nerves that arise from the last part of the spinal cord extending downward like this, and forming coda equina. So this is the coda equina. What about the meninges? The this is the bone, the dura and the arachnoid end here at the second sacral piece. While the pia which is attached to the spinal cord here, descending downward inside the lumbar system and called phylum terminal internum, and continue downward to appear from the sacral hiatus or the opening in the end of the sacrum and attach to the dorsum of the second piece of the coccyx and called phylum terminal externum. Okay, and here this is the lumbar sphere. Lumbar sphere is a dilated part of the subarachnoid space. Here, the lumbar system is a part of the subarachnoid space below the conus medullaris. It extends from L2, which is the end of the spinal cord, to S2, which is the end of the dura and arachnoid. It contains the coda equina, which are the roots of the spinal nerves, containing CSF and containing phylum terminal interna. What is the clinical importance of the lumbar system? The lumbar system is the site of the lumbar puncture. What is lumbar puncture? Lumbar puncture means like this, inserting a needle in the subarachnoid space. Inserting a needle in the subarachnoid space or in the lumbar space called lumbar puncture. Lumbar puncture. Okay? If you know that the spinal cord at the lower border of the first lumbar vertebrae, what is the common site of lumbar puncture? Below this level. Below this level. So the safe side or the safe level to insert a needle usually between the third and fourth lumbar vertebrae. Third and fourth lumbar vertebrae. You ask your patient to lie on his side and flex in flexed position, and here the upper border of the iliac crest, lies opposite the fourth lumbar vertebrae. Above it, we find a space which is the space between the third and the fourth lumbar vertebrae. Also, we may meet it between the fourth or the fifth lumbar vertebrae. What is the importance of lumbar puncture? While we insert a needle in the lumbar sternum, firstly to take a sample from the CSF, to take a CSF sample. It may be therapeutic in some cases to decrease the intracranial pressure. If the intracranial pressure is elevated and you insert a needle like this, CSF will drop down and you will lower the intracranial tension. But this is done under precaution. The second is through analysis. Analysis for the CSF drain. The CSF may contain blood in hemorrhagic or in cerebrospinal hemorrhage, or may contain pus if there is meningitis or bacterial infection inside the nervous tissue. Also, we can inject drugs like anesthesia or like antibiotics in cases of infection. So, the lumbar puncture means insertion a needle in a lumbar sphere. It usually lies between L3 and L4 below the end of the spinal cord, and to avoid its injury, the injury of the spinal cord, or below the level of L4 and L5. The roots of the spinal cord doesn't injure during the injection because the root is not fixed. The root is freely swim in the subarachnoid space or freely swim in the cerebrospinal fluid. while the spinal cord is fixed by the denticulate ligament and fixed by the filum terminal. So if we do injection at its level, it will be injured. Okay, while the nerve root doesn't injure or doesn't be injured as it is not fixed, swimming in the fluid. What is the importance of lumbar puncture? Taking the CSF sample, as we said, sample may contain pus in case of meningitis or contain blood in case of cerebral hemorrhage. Second, to measure the CSF pressure, and as we said, we make the pressure increase if increases intracranial tension. We can drop some drops, a few drops of the CSF to outside. And lastly, for drug injection, these drugs may be anesthetics or antibiotics. Now test yourself. What is this? Yes, this is a section of the spinal cord. Here, the vertebral bodies, which is marked by number 2, vertebral bodies anteriorly, and here, number 1, the intervertebral disc, between the vertebral bodies. Posteriorly here, this is the spine of the vertebrae. Here, this is the vertebral canal containing the spinal cord, which is number 5, the spinal cord. Okay. Outside the spinal cord or the space between the dura, which is number 3, and the perimeter adherent to the spinal cord here is the subarachnoid space. Sorry, this is number 3. This is the arachnoid method. And the space do it here, which is the subarachnoid space. The arachnoid and the dura, which is number 3, arachnoid and dura, is passed together and between them a potential space. Outside the dura here, there is the epidural or extradural space. So the marks are firstly the intervertebral disc, second the vertebral body, third the dura mater, fourth the extradural or epidural space, fifth the spinal cord, and lastly sixth is the subarachnoid space. Again, this is a sagittal section of the spinal cord. Okay, and this is the little length as we said before. Now let's discuss the last objective in this lecture, which is the blood supply of the spinal cord. The blood supply is of the spinal cord. The spinal cord is supplied by arteries and veins, and drained by veins. The arteries supplying the spinal cord are anterior spinal artery, two posterior spinal arteries, and lastly the radicular artery. I want to know that there is one anterior spinal artery supplying the upper two-thirds of the spinal cord and also supplying the anterior two-thirds of the spinal cord. Okay, and also there is two posterior spinal arteries. Okay, each one supplies the posterior one-third of the corresponding side of the spinal cord. And lastly, the radicular arteries supplying the lower two-thirds of the spinal cord. What does this word mean? Let's see. Here, this is the aorta carrying blood from the heart. The aorta on the left side giving the left subclavian artery and the left common carotid artery. On the right side is one stem, which is the brachycephalic or innominate artery, also giving two branches, which are subclavian, right subclavian, and right common carotid. Okay, subclavian on both sides give artery called vertebral artery. This is the vertebral artery, which passing in the transverse process of the foramen transversorium of the cervical vertebrae, and lastly enters the cranial cavity through the foramen magnum. After entering the foramen magnum, it passes on the medulla oblongata, and at the upper border of the medulla oblongata, it forms the basilar artery, and this will be discussed later, inshallah, in a specific picture. Okay, so this is the subclavian artery. Subclavian artery. This is on the right side as it originates from the innominate artery. The right subclavian give origin or give rise to the right vertebral artery. The right vertebral artery, as we said, passing in the foramen transversorium. Is the foramen in the transverse process, the cervical vertebrae. Foramen transversorium like this, and lastly enters the skull through the foramen magnum on the upper border or upper surface of the atlas, which is the first cervical vertebrae. After entering the skull here, the vertebral artery on one side and the other vertebral artery on the other side passing on the medulla oblongata to join each other at its upper end and forming the basilar artery. Let's we see here, this is the subclavian. What is this? This is the vertebral. The two vertebral arteries in both sides of the medulla oblongata give rise to small or short stem like this one and the other one. The two anterior spinal arteries unite together to form a single anterior spinal artery. This is the anterior spinal artery originating from the vertebral artery. But the first artery supplying the spinal cord is the anterior spinal artery. It originates from the vertebral artery, passing in the anterior median fissure of the spinal cord. It supplies the anterior two-thirds of the spinal cord. Okay, the anterior spinal artery mainly supply the cervical region or the upper two-thirds of the spinal cord. Below this level, the flow in the spinal artery become the flow rate becomes small. So the spinal artery, anterior spinal artery, is reinforced by another source of blood, which is the radicular artery. This is the radicular artery along the length of the spinal cord. The anterior spinal artery reinforced or receive blood from other sides than the vertebral, which are the radicular artery. Again, the anterior spinal artery is formed in the posterior cranial fossa by the union of the right and left anterior spinal arteries, which are branches from the vertebral artery. Okay, it descends through the foramen magnum and runs downward in the anterior median fissure of the spinal cord. Here, this is the posterior cranial fossa. Here, this is the posterior cranial fossa. This is the petrous bone. Here, okay, this is the middle cranial fossa, anterior cranial fossa. This is the cribriform plate of the ethmoid. Okay, and here the posterior cranial fossa. This is the vertebral artery entering above the upper border of the atlas. Okay, here and enter the cranial cavity. Here in the posterior cranial fossa, this is the origin of the anterior spinal artery, one on both sides, and they unite together to pass in the anterior median fissure of the spinal cord. This is the anterior spinal artery. This is the anterior spinal artery. And this is two arteries, and this is the vertebral artery. One and the other one. Okay? This picture will be discussed later in the blood supply of the cerebral in detail. Also, the posterior spinal artery. This is one posterior spinal artery, and this is the other posterior spinal artery. It originates from the vertebral artery here and here. It may originate from another artery called pica, posterior inferior cerebellar artery, pica. And pica artery will be discussed later, which is the posterior inferior cerebellar artery. So the posterior spinal artery may arise from the vertebral or from the pica. There are two posterior spinal arteries stand in the posterolateral sulcus, of the spinal cord. The posterior spinal arteries, which are two, right and left one, posterior spinal arteries are branches of the fourth part of the vertebral or spical. Each posterior spinal artery descends through the foramen magnum at two branches, while the anterior spinal artery descends at only one branch. They pass, they pass on the front of the other and behind the dorsal root of the spinal nerve. So, the main source of the blood supply to the spinal cord in the cervical segment are from the vertebral arteries through the anterior and posterior spinal arteries. The flow in the anterior and the posterior spinal arteries in the cervical region is prominent, while lower down the spinal arteries receive blood from the radicular arteries, receive reinforcement by the radicular artery. So the anterior and the posterior spinal artery are reinforced along their length by radicular artery. So what is the radicular artery? If we look here, the radicular arteries are branches arise from the another arteries. Okay, they arise from different sources. For example, in the cervical region, they arise from the cervical artery, ascending cervical artery or the vertebral artery. In the thoracic region, they arise from the intercostal arteries. In the lumbar region, they arise from the segmental arteries. So the radicular arteries had different sources or different origins according to the region. The radicular artery, okay, enters the spinal cord or reach the spinal cord through its roots, okay, passes with the spinal nerve and divides into two branches passing with the roots of the spinal nerve. This is the anterior branch of the radicular arteries, passes with the ventral root of the spinal nerve to join the anterior spinal artery. This is the anterior spinal artery in the anterior median fissure of the spinal cord. Okay. The second branch of the radicular artery is the posterior branch, which passing with the dorsal root to join the posterior spinal artery. This is the posterior spinal artery in the posterolateral fissure. Okay. So the radicular arteries reach the cord along the root of the spinal nerve. They divided, the radicular arteries divided into two parts, one joining the anterior spinal artery and the other one joining the posterior spinal artery. Note here the anterior spinal artery supplying the anterior two-thirds of the spinal cord. The posterior spinal artery, each one surrounds the corresponding posterior one-third, and the radicular arteries reinforce the anterior and posterior spinal arteries along their course. Again, this is the radicular arteries. Here, this is the vertebral artery, give origin to the anterior spinal arteries, two small anterior spinal arteries joined together to form the anterior spinal artery here, which is descending downward. The anterior spinal artery along its course is reinforced by segmental. This is the segmental or radicular arteries. Radicular arteries. The radicular arteries have different origins. In the cervical region, they are arise from the vertebral or ascending cervical. In the thoracic region, from the intercostal, and in the lumbosacral region, from the segmental arteries, which are lumbar and sacral arteries. Also, this is a transverse section showing this is the anteriorly, this is the anterior body or body of the vertebrae, and this is the muscles of the back, okay, and this is the spine or neuronal arch. Here, this is the spinal cord. The spinal cord containing anteriorly here, this is the anterior spinal artery, and posteriorly here, this is two posterior spinal arteries. Okay, if we look, this is the aorta. The aorta give origin to the intercostal arteries. This is the intercostal arteries. Okay, this posterior intercostal arteries give origin to the radicular artery. This is the radicular artery. This is the spinal nerve roots, and this is the spinal nerve. The radicular arteries here passes with the roots of the spinal nerve. This is one branch, anterior branch, and this is the other branch, posterior branch. The anterior branch join or reinforce the anterior spinal, and the posterior branch join or reinforce the two posterior spinal arteries. So again, and lastly, the blood supply of the spinal cord. The blood supply of the spinal cord is the anterior spinal artery, which is a branch of the vertebral artery. The anterior spinal artery supplying the anterior two-thirds of the spinal cord. The occlusion of this artery gives some sort of infarction to this area of the spinal cord, and we have a syndrome called anterior spinal artery syndrome that will be discussed with the lecture of the facts. Here, the posterior spinal arteries, this is two posterior spinal arteries, okay, supplying the dorsal one-third of the spinal cord, each one supplying the corresponding part on the right and left side. If we see the anterior and posterior spinal arteries are reinforced along their courses by these radicular arteries. The radicular arteries have different origins, so it may arise from the vertebral artery or ascending cervical artery in the region of the neck, posterior intercostal arteries or the intercostal arteries in the region of the thorax, lumbar or sacral arteries in the lumbar and sacral region. Okay. What about the venous drainage of the spinal cord? The spinal cord is drained by 6 longitudinal channels. 6 channels here, 3 dorsal and 3 ventral longitudinal channels. They are called venous channels. These venous channels will collect together and form a plexus of veins present in the extradural space or the epidural space. This plexus of veins is called internal vertebral venous plexus. Like here, this is the internal vertebral venous plexus outside the dura, between the dura and the intestine. Okay, this plexus is formed by the 6 longitudinal channels draining to outside by the internal vertebral venous plexus. This plexus, which lies between the dura and the meninges, between the dura and the endosteum lining of the vertebral canal, here in the epidural space and surrounded by epidural fat, is drained outside the vertebral canal, here like that, drain outside the vertebral canal and form or drained by the external vertebral venous plexus. The external vertebral venous plexus lies outside the vertebrae, lies outside the vertebrae. Okay, so lastly, we discuss the external features of the spinal cord. We talk about its length, its extent, its enlargements and segmentation, and discuss the myotomes and dermatomes related to the segmentation of the spinal cord. After that, we discuss the protection of the spinal cord. We discuss the meninges, the meningeal spaces and their contents, and we discuss the subarachnoid space, the lumbar cistern, and its clinical importance, what's called lumbar puncture. After that, we discuss the blood supply of the spinal cord, including the arterial supply by the anterior and the posterior spinal artery with the radicular arteries, which are considered the radicular arteries considered as the main blood supply of the spinal cord below the cervical region. And lastly, we discuss the venous drainage of the spinal cord, which is drained by 6 longitudinal channels, together drain into the internal vertebral venous plexus, and the internal vertebral venous plexus drains outside the bones by external vertebral venous plexus. Thank you.